Focused on women's heart health, the panel tackles a critical health issue while featuring two prominent physicians who bring a wealth of insight and excellence daily to patient care on Staten Island and beyond. They are Dr. Supreeti Behuria, Director of Nuclear Cardiology at Staten Island University Hospital, and Dr. Fiona Shehaj, Chief of Women's Cardiovascular Health at Richmond University Medical Center. This is Conversations with Community Giants.
Everybody, thank you for coming here. Shane DeMayo of the Staten Island Advance, another beautiful Facebook Live and a conversation with community giants. We got a really special treat today. This is about women's heart health, and it's going to be a fantastic. First of all, everyone, a round of applause for these two women that are here today. Thank you so much for coming out here. And again, this is going to be just like we did last time, getting some great answers from some experts here in the field. First off, I want to throw it over to Gracelyn Santos, doctor herself, and the chairwoman of the Advanced DEI Committee. Gracelyn, thanks for having us here.
Thank you, Shane. Thank you, everybody, and welcome. We have the newsroom staff here with us today. We have everybody on Facebook Live with us today. We have two wonderful panelists who we will introduce in just 1 second, but I do want to welcome our senior leadership who we are thrilled to have with us. We have Caroline Harrison, the president and CEO of Advance Local and the publisher of the Staten Island Advance. We have our editor-in-chief, Brian J. Leyline, with us today. We have Jerry Mobley, who is the vice president of DEI for Advance Local. We are thrilled to have you here. Welcome. And we have also Gail Lubin, our senior content director. And I have asked for our publisher to say a few words, and she has graciously agreed. Please welcome Caroline Harrison.
Gracelyn, thank you for the opportunity to speak today, just to welcome everybody. And thank you to Gracelyn and our Staten Island DEI committee, who continues to do this really wonderful work focused on our mission of serving our community, elevating all voices in our community, and bringing in this great conversation today. I'm also really pleased that our VP of DE&I for our Advanced Local enterprise, Jerry Mobley, is here with us today. So welcome to you, Jerry. It's an honor to have you here with us. You know, when I was thinking about this topic today in advance of this panel, and really thinking about the importance of health equity, I think this discussion is going to uncover such an important conversation for us today. You think about the vicious cycle of inequity in healthcare and what that does, and how it would change our community if all people had access to healthcare. What a difference that would make. So I know this is just one slice and one topic, and thinking about women's heart health. It's such an important and overlooked area. But really, if we're doing just a small part of elevating health equity for all in all forms of health care, it's such an important step today. So again, thank you for the invitation to speak, and I look forward to a great discussion with this panel. Thank you.
You did. Thank you, Caroline. The Advance SI Live DEI Committee hopes the discussion will inspire ways where we can best represent the communities that we serve, foster relationships where everyone feels comfortable and included, promote awareness of different perspectives, and exchange ideas on ways to identify challenges of underrepresented groups. As Caroline said, health inequity is a major issue in today's society. Together, maybe this discussion will be a small part of identifying opportunities for improvement, especially in the critical health crisis of women's cardiovascular disease.
Thank you very much, Gracelyn. Now let's introduce the two panelists who are here and graciously giving their time to us. First off, top two cardiologists, I'm going to say, on Staten Island. That's how I'm saying it. Supreeti Behuria, MD, the Director of Nuclear Cardiology at Staten Island University Hospital, Northwell, and Fiona Shehaj, MD, Chief, Women's Cardiovascular Health, Richmond University Medical Center. Another round of applause for them, please. Thank you so much for taking the time here today. And I have a stat here that of course I knew, but Gracelyn wrote it for me. Of course I knew this stat already. According to the CDC, Heart disease is the leading cause of death for women in the United States and can affect women at any age, with more than 60 million women, 44%, in the U.S. living with some form of heart disease. In 2021, it was responsible for the deaths of 310,661 women, or about 1 in every 5 female deaths. Graceland.
That's right, Shane. Those are frightening statistics. Even with today's advancements, about half, or 56%, of women recognize that heart disease is their number one killer, and it's a silent killer. Knowing the facts about heart disease, as well as the signs, symptoms, and risk factors, can hopefully mitigate these numbers, and we can all take steps to better health and protect ourselves, especially women, to seek proper treatment if you need it. So let's get into it, Shane.
Beautiful. Let's do it. And out of the 4 people up here, only 1 is not a doctor. So you don't really want to hear much from me. Let's just jump right into the questions right now. First off, how does heart disease present itself differently in women as opposed to perhaps men? And what are the symptoms? We'll start off with you, Dr. Behuria. You can take the mic right there. Beautiful. Thank you.
Thank you so much. And again, thank you everybody for having us. It's a pleasure to be here to talk about this very, very important topic. So to answer your question, heart disease, as we've talked about, is the number one killer of women. And it kills more women than all the cancers combined, including breast cancer. That's why it's so important for us to talk about the presenting symptoms. So heart disease in women presents with chest pain, most commonly, just like in men. But in women, we can have different symptoms as well. For example, shortness of breath, a decrease in exercise capacity. For example, last month I could walk 5 blocks, no problem, and now after 4 blocks, I'm feeling some shortness of breath and chest tightness. That's also a symptom. Women also sometimes have some gastrointestinal symptoms, like nausea or feeling of uneasiness in their belly. These are symptoms of heart disease. Of course, if you're exerting yourself and you have chest pain, shortness of breath, you burst into a sweat, all of this gets better when you rest. Those are symptoms of heart disease as well. And it's very important that if you do have these symptoms, to seek medical care immediately. Fiona, do you have anything to add?
Sure. And thank you everyone again for having us in such an important topic as well. And of course, Preeti, thank you for that as well. I agree also. I've had quite a few patients that have presented in many vague, not specific ways, even feeling of anxiousness, feeling of fatigue, feeling of acid reflux, or more on the epigastric area of the abdominal area, not necessarily on the chest area. And then women also, we tend to have other signs besides other signs of heart disease. We also tend to have the non-traditional forms of heart disease as well. For example, spontaneous coronary artery dissection is something that affects women of any age, but mostly women in pregnancy, women that are undergoing hormonal changes such as in menopause. Broken heart syndrome is something that affects women exponentially much more than it does for men as well. That too affects women with changes in emotional distress or stressful situations throughout their life also. We have a higher incidence with things like that. And we tend to present in those kind of diseases, we tend to present also with vague symptoms as well. So it's very important that we pay attention to women when they come to us with these complaints, because it might not just be acid reflux. It might not just be anxiety that's affecting them. Sometimes time is muscle, as we say in cardiology. So it's very important that we take the proper history, the proper testing that we need to do for these patients in order for us to identify quickly in order to prevent further loss of function, loss of life, and loss of their quality of life as well.
That's very interesting facts. Thank you, Dr. Shehaj. I was wondering, are there any specific lifestyle changes that we can make as women to kind of lessen our probability of falling into that category of having an emergent episode like that with our heart? I know, a lot of people can be, they don't want to be a hypochondriac saying, oh, is my acid reflux? Oh, is my stress? Is my anxiety? Is this a heart attack? But so my question is, are there lifestyle changes that you recommend for your patients?
Yes, absolutely. I think that heart disease is mostly a product of your environment. I know we talk a lot about genetics and our genetic predisposition to heart disease, but that is only a small portion of the effect that our environment has on us and our health. So I definitely, when I do take my history of the patient, I take into account their day-to-day activity levels, what their job burden is on them, or their family life burden is on them. And I essentially try to keep all that in mind in order to give them the best advice that I can based on their day-to-day life. But of course, we want them to exercise at least 150 minutes per week. We want them to eat as healthy as possible, a very balanced diet, and the Mediterranean diet would be the best possible diet to follow in that regard. And then also to take care of their stress levels as well, because we definitely, as a society, are a very stressed out society. So we want to also pay attention to those triggers and see what else we can do in order for our mental health to be in check as well. I don't know, Preeti, if you have anything else to add as well.
One thing that I have noticed in our community here in Staten Island is smoking is a big issue. The best thing that you can do for your heart is really to stop smoking. The smoking really causes that bad stuff in your arteries to break off and cause heart attacks and strokes. So that's one thing I really stress with my patients. If you smoke, that's the best thing you can do for your heart. So that's one of the other lifestyle modifications that we can use.
Speaking of heart attacks, if someone's experiencing a heart attack potentially, what can they do during that moment to perhaps try to survive? Or what can someone do if they're witnessing someone a heart attack? What's the best practice there?
The first thing you have to do is call 911 and go to the emergency room if you think that you're having a heart attack. As Fiona said earlier, time is muscle for us. For the heart, it's extremely important to get to medical care as soon as you can, because if you are having a heart attack, as soon as we open that blockage and allow blood flow and oxygen to the muscle of your heart wall, that gives us a better chance of recovery. It gives us a better chance of survival. So if you are having the symptoms of a heart attack, call 911 and go to the emergency room.
Dr. Shehaj, it seems like open heart surgeries, from just anecdotally talking to people, are less common these days. I know that I've heard about robotic techniques and a lot of other advanced surgery techniques that there are out there. Could you just speak on that?
So as a society, I think we always try to look for more non-invasive route of taking care of things. And there's a couple different reasons why CABG or open heart surgeries are going down. One of the main things is that patients just don't want to go through such a huge surgery. They rather have a fix where they can be back to work, back to their normal life within a few days. And that's what percutaneous interventions do for people, or placing stents, as opposed to having open heart surgery. Well, it takes at least about 90 days to really kind of get back into a normal routine. With that also, surgery is just more expensive. It's more expensive on the system as a whole. It's more expensive also for patients, co-pays, depending on their insurances as well. And then also for the past decade or so, there's been a decline in open heart surgeries for about 30%. And that's also because patients are getting sicker and sicker and not maybe seeking medical care where they should be. And so by the time that they do need to have their surgery, they're not maybe candidates for such a surgery. And then we move to the more non-invasive approach.
We spoke a little bit before, both of you, about the lifestyle changes you can make to try to help improve your heart health. But besides medications, other alternative or complementary therapies, what other things can women be doing?
Sure. So I would say that nothing is better than evidence-based medicine, so that we definitely the route that we take. But there are, of course, other ways that we can supplement our traditional ways as well. And that comes with, I mentioned before, with stress relief. So definitely something that we need to hone in on is doing things that will make us feel better, just mind and body as well. So exercise will do that for us. That's also, yoga, tai chi, or anything that will kind of get us to a more centered, more balanced sort of way of thinking and doing things. Do you have any?
Sure. One thing that I do recommend to my patients is meditation, because that really helps to strengthen our mind-body connection. So if you're not used to meditation, there's some apps online. One is Headspace and one is Calm that I use myself too. And you don't have to do like hardcore meditation, sitting in a room for 45 minutes. 10 minutes of breathing exercises, 15 minutes of, listening to a story and breathing through it. They're really, really good, I feel, to help with stress reduction techniques and also sleep, which really affects your heart health as well, to have good sleep hygiene.
Interesting. Dr. Behuria, could you please speak on comorbidities, in terms of patients that you may encounter with diabetes who may have a family history, a genetic predisposition to, high blood pressure and to cardiovascular disease? How does all that come into play? And, we have to deal with the hand we're dealt with, right? We have these genes, and how can we escape that cycle?
Absolutely. So that's a great question. Heart disease is certainly genetic. It's familial. But no matter what your risk factors, 80% of heart disease is preventable. So whatever hand we're dealt, we can still do things to make our prognosis from heart disease or prevent ourselves from ever getting heart disease. So the biggest risk factors for heart disease are diabetes, high blood pressure, and high cholesterol. So it's important to start getting screened early if you have people in your family who have diabetes, high blood pressure, or high cholesterol. So going regularly to doctor's visits. For women, unfortunately, a lot of us don't have primary care doctors, right? A lot of us see our OBGYNs once a year and expect that everything will be done. However, unless you get your blood pressure checked, your blood test done for cholesterol and diabetes, you don't know if you have those illnesses. A lot of our OBGYNs are really wonderful and will do our tests for you, but I can't stress enough that it's important to have a primary care doctor, important to get your basic screening so that we can work to mitigate these risk factors. And of course, it's never too early to start with our lifestyle modifications. As we talked about earlier, a heart-healthy diet, regular exercising, those things are extremely important as well. Fiona, do you have something to add? Sure.
And when we think about genetics, we think about, just DNA and what we encounter, with our family, what they've passed down to us. And it's not just DNA. It's also how we are raised when it comes to diet and what's important in our family life. So it's very important that we, maybe set the example, set the tone for our family members, for our kids, for even our parents, that we need to make these changes in our lifestyles. And it might be a good thing to do as a family together, maybe cook a few meals together throughout the week to kind of get into that role of better eating habits and better exercise habits as well.
Now, doctors, I am a licensed WebMD practitioner, which means I think I know how to check all my problems on my own online. It's probably because I'm just scared to go to the doctor, like I'm sure many people are. Can you walk us through a comsultation and what it might be like for a woman coming to go inside and check what it's like for her heart?
Yes, absolutely. So in our practice especially, we try to make it seem more as a family-friendly environment, and there's no judgment at all. So we start off with the patient first being taken in by our medical assistants. They take in all the different information, what medications they take, any family history, any prior medical history or surgical history. And then that's when I come into the room. So when I come into the room, essentially my job is not to take notes or to be stuck on the computer, but to have a discussion, face-to-face discussion with this human being that's in front of me and that's in a very vulnerable position. And they might have not seen a physician for the past 10 years, and this is their first time. So that's the discussion that we have. We start off with, why they decide to come in here today, what is bothering them first and foremost. We get into their lifestyle habits. We get into their dietary habits. And I like to ask them a very important question. I like to ask them, in what do you consider healthy on a healthy day for you? What do you eat? What do you do? What activities do you do? What things do you do to make yourself feel better? Do you have any hobbies? So we go through a whole lifestyle questionnaire about their day-to-day, because that will help me not only tailor their medical therapies, because some patients are not keen on taking 2, 3, 4 medications or multiple medications daily. They want to just take one thing or maybe one time a day medication. And then that will also tailor to me how many times they will come back to see me again, what their family home life is like, if they will be coming back to see me in a couple of months. So it really gives me a better understanding to ask those questions about their everyday work, their everyday way of living. Yeah. Do I have Preeti?
Sure. A lot of patients are afraid that when they come to the heart doctor, we're going to rush them to a stress test or rush them to the hospital. Usually the first visit is just getting to know you better. We certainly will do an EKG, an electrocardiogram, where we map the electrical activity of your heart, check your blood pressure, your heart rate, your vitals. But it's really just a discussion, as we talked about. And it's very important for women to know that your heart doctor will ask you about certain women-specific risk factors. So there's a lot of risk factors for women that are different than men. For example, complications during pregnancy. So if you had gestational diabetes or if you had preeclampsia, that'll increase your risk of heart disease in the future. If you were ever diagnosed with something called PCOS or polycystic ovarian syndrome, that'll increase your heart disease risk in the future. So women will get asked these questions a lot. Sometimes my patients are confused, like, why are you asking me my pregnancy history? But it all matters for heart disease.
Dr. Behuria, could you please speak on, say a patient comes in and presents with having had a diet of fast food their entire lives, say they're in their 20s or 30s. And, I always say convenience is the bane of our modern existence, right? Sometimes it's not feasible and it's not a reality for men and women to make dinner every night and to be as heart healthy as they would like to be. So there's fast food and there's food that's just higher and a lot of ingredients are not as healthy for you as the Mediterranean diet that you said. So can all that be reversed? Can all the damage that's been done in your arteries, with the plaque buildup, is it too late? Is it reversible?
So it's never too late to make lifestyle changes. And I'm very cognizant of the social determinants of health, right? It's very easy for me to tell patients, like, go to an organic grocery store, get all these veggies, cook dinner every night. But that's really not reality. That's sometimes not reality for you and me either. So I tell my patients to make small changes every day so that they're sustainable and they can last for a really long time. So instead of choosing a burger when you go out to a restaurant, choose a salad sometimes, not every single day. We don't want to be extreme and, those changes are not going to be sustainable. So small, sustainable changes, I think, are very important. And then working with your patient, because everybody's social situation is different, working with them to understand what is feasible for them and what is not, and trying to find ways and giving them a toolbox to really help their heart health that way. Fiona, do you have some fish?
Absolutely. I will echo that as well. It's not about making all these drastic changes right away because it's definitely not feasible and might not be even sustainable for the patient to do that. So we want patients, like Preeti just said, to make even small changes because in the long run, they will add to really a large change in health, maybe decrease weight loss as well, decrease in their blood pressure numbers. So it'll add up. But definitely I tell patients, let's say you're going out to a restaurant, if let's say the side is a starchy or like rice or a potato, maybe instead of doing that, maybe get steamed vegetables instead. So you can still have your main meal where, that was the star of the show. That's what you went out to eat. But on the side, definitely do a little bit more of a health conscious sort of choices there. And drinking more water as well. We tend to be a society that's on the go always, maybe lots of coffee, lots of sodas, but making that very small change of just decreasing your juices, decreasing your sodas, and just replacing those easily with water, they can add up to a big change as well.
I just want to let everyone know and remind our audience on Facebook that this is Shane DeMail for the Staten Island Advance. Graceland Santos right next to me, and this is the Staten Island's second one that we have so far for Women's Heart Health, a beautiful gathering that we have here from our diversity committee. I also want to remind both of you, Graceland and Fiona, that our tech, Steve, said, higher the microphone when you guys are talking. You have beautiful voices. We want to be able to hear you. Me and Dr. Behuria is doing a great job. I just want to pat ourselves on the back. So it's true. I want to ask you both, what role does hormonal health, specifically birth control and hormone replacement therapy, play in heart disease for women?
Sure. And I think Preeti touched a little bit upon this right before. Estrogen tends to be cardioprotective. And as women near menopause and after, we have noticed a trend of heart disease picking up. Usually we would think that men have a higher chance of heart disease, and that tends to be true up to a certain extent. But then after menopause, women tend to kind of catch up when it comes to that, the risk of heart disease. Also, birth control pills, for example, depending on the population, they don't necessarily directly increase your chance of heart disease, but they can increase your chances of blood clots. which can go into from, let's say, from the legs into the lungs, causing increased pressures within the lung chambers, and then also causing problems in the heart as well. So those are some of the things that can potentially cause some issues.
Dr. Shehaj, and actually Dr. Behuria also, I know that you ladies, you doctors are the heads of your cardiology specialty in Staten Island University Hospital, Northwell, and Richmond University Medical Center. Do you find, seeing thousands of patients every year, that there are women that come from certain demographic locations on Staten Island who are not getting as much care or as good a care that they should be to address any issues that they may have for their heart health? And how is this addressed? Are there outreach programs? Are there ways that we can reach the women who are not getting the care that they need? Healthcare should be available to everybody, but unfortunately, that's not the reality. So if you could speak on that, and if you could please speak to our, larger audience on Facebook Live about where women can go, where they feel they have a problem and they just don't know where to turn because, like you mentioned, they don't have any primary caregivers. And what advice can we give them?
Absolutely. I think discussions such as this tend to also spread a lot of awareness, spread a lot of information, and get women kind of on higher alert that they may need to go see someone or speak to somebody. And like you mentioned, Graceland, it's not always feasible. Insurance, unfortunately, does not cover everybody, and it's not out there for everyone to have, or that it's not affordable. But there's always community outreach places that can be of better information and direct people to the resources that are available to them. There's also religious groups and religious institutions that also tend to have community days and outreach programs to have more women involved in care. I myself, and I'm sure that Preeti does as well, we tend to do a lot of, almost every month we take part in the community where we do blood pressure measurements, EKGs for the community as well. And those are some of the first things the first contact that we have with our patients, where we can spread a little bit of awareness and tell them, where to go from there, where to go next. Yeah.
Sure. So I totally agree with Fiona. Unfortunately, we can't touch every single patient that we want to. At Staten Island, we do try to do community events once a month, especially at religious organizations, so temples, churches, and those are very, very well attended and let us catch a lot of heart disease. We also in Staten Island have our community clinic where we serve a lot of patients who are uninsured or underinsured, and we work with them in order for them to get the care that they deserve and need.
Specifically, when we're talking about menopause, how does menopause affect heart health in women, and what steps can be taken to manage any associated risks with that?
Absolutely. So as Fiona said earlier, estrogen is cardioprotective. It protects the heart. When menopause happens, we lose the estrogen from our bodies. So menopause itself is not a risk factor for heart disease, but the changes that happen to a woman in menopause can increase heart disease in the future. Your blood pressure tends to go up. You start having some central obesity, like gaining weight in your belly, that increases your risk of cardiometabolic syndrome. Your cholesterol blood work goes up as well. So the best thing we can do is when menopause starts to happen, which we can't avoid, when menopause starts to happen, go see your doctor, get that screening, get your blood pressure checked, get those blood tests done so that you're on the game, you're on the ball, and you can take care of your heart the best way possible.
Yes, absolutely. I agree with that as well. And also there's some patients that might be candidates for estrogen replacement therapy. So that's also another discussion to have with your provider as well.
I know that some of my friends and just reading about pregnancy hypertension, what is that about? And why do some women suffer from it during their pregnancy, during the gestational period leading up to delivery, and some don't? And are there ways for women to avoid that? Because I know it's a very dangerous situation.
Absolutely. So conditions such as preeclampsia, where the blood pressure dangerously goes up higher, more towards the third trimester in pregnancy, and also beyond, even after delivery, can be affected by this. and eclampsia as well. So those are some of the scary conditions that we deal with in pregnant women. So it's not well understood why these kind of conditions happen in women. It could be genetic, it could be lifestyle, it could be just the predisposition of these occurrences in these women. It's very important to have, so let's say if you did not have good primary care, it's also important at that point to have a good OBGYN care as well, because usually that's where those conditions are first presented. That's where they're first caught. So very important to follow up with your practitioners, getting your blood pressure checked, getting your blood test done, your urine checked for any proteins or any telltale signs of those conditions.
For any women that are watching right now on the Facebook Live, or when we have our video that goes out later on all our social media channels, and they're thinking, hey, this sounds like great information I'm getting, obviously, from both you doctors. I need to go get checked. How often should women be going to get checked for their heart health?
That's a great question. There's no set rule as to how many times or when you should go get checked. It starts off even with your pediatrician, kind of seeing what your congenital heart disease risk factors are like, what your parents have gone through. So usually, like Preeti mentioned before, your primary care doctor is your great first point of contact, because they really are the gatekeepers. They're the ones that are identifying things early on. They're the ones doing the blood test screenings, the blood pressure screenings, and so forth. So those, and then depending on what your risk factors are, depending on where your history of heart disease is, then we tailor it to the patient. We can see the patient once a month. We can see the patient every few months, once a year. So it all depends on that specific kind of tailor to the patient.
Dr. Behuria, we hear all about the apple-shaped body and then the pear-shaped body. Could you just enlighten everybody on what that means and what, if any, risk factors there are for the different types of distribution of fat in women?
Absolutely, Gracelyn. So I think it's just important to know that, no matter what shape your body is, what matters in heart disease is where your fat distribution is. So when your fat distribution is more around your belly, then it does increase your risk of heart disease. So it increases your risk of diabetes. The central obesity leads to cardiometabolic syndrome, which is like diabetes, obesity, and that increases your risk of heart disease as well, because the more weight you gain, the higher chance you have of having high blood pressure, of having high cholesterol, and that'll increase your risk of heart disease also.
And Grace, if you need a doctor, we have two right here. So are you sure? Just want to let me know. Okay. All right. You might have a new patient right here. We stress. Sorry. Just for the coughing. That's the only thing I wanted to make sure. Stress. She's fine. Stress management, mental health, and other things that can affect the heart. You mentioned a lot about the exercise and the eating, but how important is it for that mental health and stress? How much does that fuel any heart problems that a woman could have?
Depression, unfortunately, is not diagnosed as much as it should be, and depression goes alongside with heart disease. There's data to show that after somebody's first heart attack, they have an increased rate of depression. And it's not often, even as heart doctors, that when we see patients in the office, we ask them about their mood, right? And that is so important. And women, unfortunately, are more inflicted by depression than men are. So mental health is so important. We can do so many things to help our mental health, like exercise, good diet. We talked about yoga, meditation, good sleep hygiene. But if you do feel symptoms of depression or anxiety, it's really important to get services for mental health. Do you have anything to add?
Absolutely. I agree with that. And then also, a depressed patient is not going to necessarily follow your advice. They're not going to take the medication that you prescribe them. So it's important to gauge where the patient is regarding their disease process and how they're adjusting to their new, maybe a new change after a heart attack or after a diagnosis of heart failure, where they might need to take 4 or 5 or even more medications than that. So it's important that we gauge where exactly the patient stands on their new life, on their, after the diagnosis, and where they stand and how their willingness to participate in their own health as well. Because that's, we can make the treatment plan, but we cannot force the patient to take these medications. We cannot force them to come to their appointments. So it's very important that we gauge that their mental health is also there, and they're, having an easier time understanding what's going on with their bodies, why they're taking the medication that they're taking, and also to help address any issues early on, because we don't want to lose contact with these patients and then they come back let's say 5 years later in the ER with an even more severe disease, or near death, or with a very bad, poor quality of life.
In the news lately, especially with celebrities, Ozempic and Wegovy and all those kinds of new drugs are all the rage, right? And so I think it's creating a healthcare problem for diabetics who actually need those medications. But do you recommend to your patients, or what is your personal point of view about regular people like all of us to take those kinds of meds to lower their weight so they can lower their risk for cardiovascular disease? And if you can touch upon, because I'm not even sure that anybody knows how Ozempic works, if you could explain that to us too.
Sure. So these new and exciting medications, they essentially send a signal to our brains of a more fullness kind of sensation. So you don't overeat, you're not eating as frequently or as much. And they also will slow down the process of how our bodies break down food. So you stay fuller for longer periods of time. And obesity is also another risk factor for heart disease. So it is important that we have we discredit the stigma against these sort of medications, because obesity is just like any other disease, is just like high blood pressure and high cholesterol. And a lot of these patients with obesity, it doesn't happen overnight. They've been struggling with it for decades, and they're at the end of their rope, or maybe they've tried multiple different diets and exercise programs, and nothing has helped for them. So this is just another route to take, in conjunction with proper eating habits, in conjunction with exercise, to help them get to their goals. So I'm actually very pro these medications. And when patients approach me, my only gripe is that insurance companies don't, they're not keeping up with the guidelines and with our wants and wishes for our patients to lose weight as well. Wegovy, thankfully, just recently was approved by the FDA to improve cardiovascular health for patients. So that's exciting in our field. But yeah.
You both touched on it a little bit also. I think, Dr. Behuria, you said drink more water. You said the Mediterranean diet. What are some more specific heart-healthy foods that people could be eating to replace some of those bad foods that they're eating?
Sure. So I tell patients any vegetable, whatever they like, choose vegetables above all, because they also have high amounts of fiber, which helps with cholesterol, which helps with high blood pressure, which helps with digestive issues as well. So I tell patients whenever possible, if you can substitute something with a vegetable, I'm happy with that. Fruit as well, any fruit of their choice, but I tend to recommend more berries, anything that's more of a water content sort of fruit. Water, as we mentioned before, as well. So essentially anything that's that's that vegetable, that's fruit, and less so in the red meats, because they're naturally just higher in cholesterol and higher in fat. So we don't want patients to really rely on those animal products. And if let's say they prefer chicken, I tell patients maybe more on grilled as opposed to fried, and more chicken breasts, so more those choices. So even whatever they're eating currently, just to switch to a healthier version of that food.
It's hard to make changes in your diet, but as we talked about, these small changes really go a long way. The Mediterranean diet really focuses on green leafy vegetables, fresh fruit, also fresh fatty fish, right? Like salmon, that's very good for your heart. Eating legumes to add that fiber and protein to your diet. These days we have more and more data to show that the plant-based diet is the best diet for your heart. So as plant-based as you can be, that's pretty hard to do, to be honest. I've tried it a bunch of times myself, but I simply can't seem to keep up with it. But really as plant-based as you can, cutting down that dairy and making those small changes really go a long way. Our
society these days people have been turning to vaping instead of smoking. And they think that, I'm doing something good for myself because it's healthier. Could you please address that? And, what is the reality, and what should people do about vaping? We all know that it's bad for you, but why? And if we could just underscore that.
Yes, I would say do not vape. It is not good for you. It is not an alternative to smoking. Vaping, actually, because of the filters that they use, is really bad for your lungs. So vaping is not a good alternative to smoking. It doesn't help your body at all. It affects your lung health, your heart health, and I really would not use it as an alternative to smoking. It is not a healthier route to smoking. The best thing you can do is to give up smoking and vaping, if you do it, that's the best thing for your heart.
I'm going to come from the perspective of the ignorant male here, which I play pretty true to form. Speaking about women's heart health, growing up, my mom kept telling me that if I keep stressing her out, it's going to kill her. And I still drive my wife nuts. So as a partner, what can I do best to help my wife make sure I try to help her stay healthy, whether that's in the diet, whether that's in the stress? What are the best practices for me? And what should I look for to see if she's maybe unhealthy and she doesn't even recognize it?
Absolutely. That's a great question. And that's a very empathetic partner question. So good job. So, women often ignore their heart disease, right? Women are focused on taking care of their kids, taking care of their spouses, their parents. They often forget that they have to take care of themselves as well. So when I have women come into the office, I really do stress that, like, you matter, your heart health matters, you have to be your own heart hero, you have to advocate for yourself and get good care and continue to take care of your partners and your families. So as a partner, I would say to work together to improve your heart health. If your spouse comes in and they've been told that they have to have a heart healthy diet, work with them. Change your diet as well so that it's easier for them. I love group activities that families can do together. So when we're saying get 150 minutes of exercise a week, do something together as a family. Motivate your spouse to exercise with you. Those things are really important as well. And if you notice that your spouse or your partner is stressed out, talk to them about what you can do to alleviate your stress. A nice bouquet of flowers goes a long way. Don't get me wrong. Fiona, do you have for sure?
Yes, definitely. I would have to agree with exactly what you said. And shared responsibilities. A lot of times women feel that they do not have time for themselves. So as a partner, what you can do is to alleviate some of that and maybe give the partner in your life, the woman in your life, some time to take care of themselves and go take care of just a mental health day, a spa day, take care of their appointments as they should be. And then also, again, in the home, as Preeti mentioned, do activities together, do cooking activities together and exercise together as well. That definitely goes a long way.
When I was growing up, I'm a little bit older, a lot older than you ladies, but growing up, cardiologists were mostly all male. And it's so nice to see that two women who are top cardiologists on Staten Island are both female. My question is two parts. The first part is, what were the challenges that you'd like to speak on as a woman in medicine? And then number two, do your patients seek you out because you are female? And what effect does your gender have on patient care on Staten Island?
Yes, so definitely, and I think I speak for Preeti as well. It's in a male-dominated field. It's been difficult at times to be recognized, to be respected in the field as well. But that should not deter women to go into our field or to keep caring for patients as we do. It's and then there have been studies that have shown that female physicians actually tend to take care of their patients a bit better. And I am seeked out by some of the patients as well because of these community outreach programs and discussions that we have. Women feel more comfortable going to other women to get their care, to get listened to, and to have their symptoms really addressed in a proper, in a timely manner, and not dismissed entirely because of because of their women.
Sure. So 10 to 15% of cardiologists in the U.S. are women. That's a really small number still. So, I'm so grateful that I can have colleagues that are women and work together with women. Patients certainly, especially women, seek out women. There's a whole emerging field of cardiology called cardio-obstetrics, where we take care of women through their pregnancies because shockingly, the U.S. is the only developed nation where maternal mortality is increasing instead of decreasing every year, which is a very frightening statistic. So a lot of these deaths during pregnancy and after are from cardiovascular disease. So we are really, men and women are focusing on the field of cardio-obstetrics to help better take care of women. So we're very lucky that there have been people who have come before us that have really shine the light on how important women's cardiovascular disease is. And we have mentors in our field who are women, and we are able to mentor young women who want to go into cardiology. And I think it's a wonderful field and a privilege to be able to be a cardiologist.
With the 5 to 10 minutes or so we have left, I want to make sure we get some questions in from the audience over here. So that microphone right there is live and ready to go. Any questions we have from people sitting here? And my favorite part is I get to just pick someone if you don't raise your hand. So anybody want to volunteer? There we go. Annalise, can we get that microphone over to Annalise? That would be amazing. Thank you so much. Annalise, take it away.
So my question is, at what age do you think it's appropriate for a woman to go and seek cardiovascular care?
That's a great question. So cardiovascular disease is a little bit different from, say, breast cancer screening or when you need to have your colonoscopy. It's not a specific age, but it's personalized. It depends on you and what your risk factors are. If you have a strong family history of heart disease, if your parents have had early heart attacks or strokes, if you have high blood pressure, diabetes, high cholesterol, go get seen now. There's no wrong or right age to get seen. It's preventative cardiology is also a big emerging field where we're trying to prevent that first event from ever happening. And as I said earlier, 80% of heart disease is preventable. So if you have risk factors, no matter your age, go get seen by a cardiologist.
Yes, absolutely. I like to echo that as well. And even asking your primary care doctor when would be a good time for me to go and see somebody based on the history that they know of you so far would be a good guidance to gauge as to when you need to see somebody. But it all depends on your family history, on your own personal history of maybe even birth defects or any congenital heart disease or certain conditions might predispose someone to have an earlier onset of heart disease as opposed to the general population. So definitely a discussion to have with your primary care doctor first and foremost.
Does anybody else have any questions?
I hear talk, maybe I've read as well, that there is a connection between dental health, dental hygiene, and heart health. And so that old maxim to tell your kids to brush their teeth twice a day is really very important. But I don't know whether it's true or not. Is there a connection there?
Absolutely, there is a connection for sure. This bacteria that's in our mouths tends to travel more towards our hearts, the GI tract. So it definitely will affect our heart health. It can burrow its way into our valves, which are structures within our heart chambers that help the blood flow go into a normal route throughout our heart chambers. So definitely, it's very important that we keep a good oral hygiene.
Anyone else? One more, Mr. Laylock?
I think when we talked in the beginning of this about healthcare inequity on Staten Island, and to Annalise's question as to what age, there's an organization on Staten Island, I think it's called One Heart at a Time. It's run by a Frank and Fran Reale, and they go into youth sports. And I'm wondering, it seems to me, and I think they do a great job, it seems to me they focus on the male. So it's either football or baseball. Can the schools do more? Can we get more into schools? They can't get into public schools, this program. It's only private and Catholic right now. But is it possible for to get into schools and to reach the female, perhaps even through sports? Because when you talk about looking at family history, perhaps in many of these communities they don't know what the family history is. I'll be frank with you. I probably don't even know what my own family history is.
That's a great point. A lot of these programs are, like you mentioned, geared more towards the male sports. Interestingly enough, there's an event that's upcoming now that we're taking part of in Curtis High School to screen football players for any heart disease by doing EKGs and taking their blood pressures and doing a quick survey as to their family history. And I did this last year, but I also requested this year that we include more ladies in the screening process as well. So I asked them specifically if there's any women's sports, and they mentioned they had volleyball and also women's lacrosse. And that's one of my requests, to also screen them as well.
Speaking of screenings and, just health, cardiovascular health in general, if you suspect that you're having a stroke, or if somebody near to you or in close proximity to you is having a stroke, please make it clear to everybody here and in the audience, what should you do? Those are precious moments, and what should we do?
Absolutely. So you know your body best. And some of these signs might be frightening. Some of these signs might be foreign or even maybe too vague to really identify that you are having a heart attack or you are having a stroke. So the best thing to do is just call 911 right away, whether it's you're seeing someone have an event or whether you're experiencing something that does not feel right to you. Call 911 right away. Do not drive yourself places. Do not take that person to the hospital yourself. So the best thing to do is just call for help.
And what symptoms should we look for? I know there are tests, tests that you could do while you're waiting for the ambulance to come, raising, they're sticking out their tongue. What are there, self-administered tests that we could do to ourselves or somebody who may be having an episode?
So, in terms of a stroke, which is what the question was, there are certain things you can do. If you stick out your tongue and it deviates to one side or the other, that could be a sign of a stroke. If you smile and your smile is lopsided, like one side goes up and another doesn't, that could be a sign of a stroke. Of course, if you feel like weakness or numbness in one side of the body, if you raise up your arms and one side goes up and the other doesn't, that could be a sign of a stroke as well. But the most important thing is that if you see these signs, please call 911 and get help, because just the same as with time is important for the heart in terms of a heart attack, it's very important for the brain as well.
One of my last questions I have is, for both of you doctors coming here today, what do you think is the main point, the number one takeaway for someone watching right now? What message would you want to get out to that woman watching right now who's maybe not as health conscious as they should be?
So I think my main message for women out there is that heart disease is the number one killer of women, and you have to take control of your heart health, advocate for yourself, seek medical care if you need to, control your risk factors, and be your own heart hero.
Very important to be your own self-advocate. So if, let's say, you go to a provider and they do not take your symptoms seriously, it doesn't mean that that's the end for you and that's where the testing stops or that's where your evaluation stops. Go until you feel comfortable that the care that you're getting is being addressed, that your symptoms are being addressed and your risk factors are being addressed as well. So definitely you have to be your own self-advocate when it comes to your care.
Lastly, what is the trend for the women patients that you see? Are things getting worse? Are things getting better? We read in the news that, colorectal cancer is occurring in younger and younger people. The rates of, other types of cancer are getting lower and lower. What is just the general trend in your practices for cardiovascular health? Are things getting better or are things getting worse?
I would have to say that it's a mixture. A lot of women think that they're invincible, especially earlier on in life. But you have to take care of yourself, and you have to go see your practitioners and your doctors. You also have to be self-conscious of all your lifestyle choices and the exercise that you get and your stress levels. So it's very important to take control of your life, as Preeti said.
We do have data that's showing that for younger women, the rates of heart disease are actually increasing versus decreasing. So again, as we said, take your symptoms seriously, take your risk factors seriously, get help if you need it, and, take your heart health seriously.
The last question I had, the last one, what flowers should I get my wife again that you mentioned before? It's got to be roses. I did it yesterday. I can do it again. I want to thank you so much for your time. I want to give some thank yous to go around before we wrap it up. It's just about that time, Gracelyn. Again, it flies by when we're getting some great information from everybody. First off, the committee members who are also here today, Felicia, Kelly, and Jason behind the camera. Shout them out. Everybody, round of applause for them. I'm happy that we were able to set this up and get everyone together. This is awesome. Also want to thank the advanced leadership that's here as well. Caroline, Brian, Gail, thank you both for coming out here so much. Round of applause for everyone here, too. Keep it nice and warm. And Jerry, of course, for coming out here. Jerry in the back, thank you so much for coming here to see this in person. This is the show that we do here. Thank you so much. And Dr. Gracelyn Santos, a doctor also. Thank you for putting this together. She puts this together. I'm gonna leave the mic with you to say a farewell to them and thank them.
Oh, okay. Thank you very much, everybody, for coming. This has been an enlightening conversation, and you two are the top cardiologists, two of the top cardiologists on Staten Island, and you also happen to be women, and you also happen to be young, amazing, incredibly intelligent and compassionate, excellent doctors. And you also happen to be women of color. And that gives me as a woman of color great pride. And we are so happy that you joined us today, because not only has the newsroom gleaned a lot of information, valuable information, life-saving information, but also everybody on Facebook Live. So we are so thankful to you. And I'm so thankful to Shane because, as I told him, people tune in because of you two and because of him, mainly because of him. They tune in for him and then they stay for the content. So we're grateful to you, Shane. Thank you so much. And thank you, everybody, for joining us today. And thank you to Dr. Behuria and Dr. Shehaj.
That's right. It's good. Good claps. That was good claps. I think we're wrapping up the Facebook Live now. Shane DeMeo for the Staten Island Advance. We could sign out right now and make sure you check out our fully edited YouTube video that Jason's going to work really hard on coming out soon. Thank you so much for watching, everyone. See you at the next one.